Hi everyone, my name is Karina Moreno Bueno. I am a program coordinator for Greenlight Durham, and today I will be presenting an overview on the program. So let's get started. As I mentioned, I am a program coordinator for Greenlight Durham, and Greenlight Durham is working in partnership with the City and County of Durham, Duke Health, the Pandemic Response Network, and Curamericas Global. An issue that has come to the attention of the Greenlight Durham team is the fact that there are many community and local businesses facing COVID-19 challenges faced in the gaps in knowledge of social care services, which then lead to small outbreaks among staff and not knowing how to handle them, for example, or not knowing where to get accurate testing information for employees, or not knowing how to implement appropriate symptom screening to provide a safer work environment for staff. Given these challenges, Greenlight Durham is offering solutions based on a community model in which Greenlight Durham serves as a digital tool to bring all of the local community organizations and resources together into one place to provide greater streamlined access to Durham local employees and employers. And by doing so, community organizations not only become empowered, but they too also offer a support system for Durham local employees and staff. And this is all done by Greenlight solutions such as providing daily check-ins for symptom monitoring, and providing a direct connection to care for food assistance, utilities relief, COVID-19 relief payments, healthcare, and much more with the assistance of community health workers that know the area very well. Greenlight Durham also provides playbooks and advising on various topics such as what to do if an employee tests positive for COVID-19. This is all supported by clinical oversight and expertise from the organizations that we coordinate with, such as the Public Health Department in Durham, Duke Health, the Pandemic Response Network, and Curamericas Global, and is further supplemented by the Greenlight program development support so that users are not alone during this process. Overall, the aims of Greenlight Durham are to provide streamlined testing with no out-of-pocket costs, to provide symptom monitoring for staff and employees, and to provide access to social care services, including COVID-19 relief payments. Greenlight Durham is a digital tool that gives Durham businesses the confidence to safely operate during the COVID-19 pandemic. Greenlight evolved from the Pandemic Response Network, which also has a community symptom watch support program. The Pandemic Response Network model does have proven results at scale. It has allowed both Duke Hospital and Duke University to run without any disruptions and without any major outbreaks. Recently, the CDC featured this model on their weekly morbidity and mortality report. When using the app, this is the interface that will be on display. As you can see to the right, there are a variety of features. At the top, you can see the button to submit a daily check-in for symptom monitoring. And toward the bottom, there are a couple of resources that we have compiled for you, including Finding Testing at Duke, in which we provide a direct hotline. There's also a button for connection to care in which one can fill out an urgent request form to request assistance from a community health worker. And this is also provided in bilingual operations. Furthermore, there is also a Contact COVID-19 Triage button in which people can call this hotline to ask any COVID-19 related questions. And there's also a button to seek local testing sites near you. This is the main interface that employees will have access to and will use on a daily basis, which are the daily check-ins. The symptom survey looks like the image to the right. It is very simple and easy to use, and is also based on guidance from the North Carolina Department of Health and Human Services. It takes less than a minute to fill out. This is a dashboard that employers can use to view a roster of their employees and the different statuses for them. These statuses can include green, meaning they are cleared for work. It can be yellow, which means that they are pending medical evaluation, or they can be pink, which means that they are in recovery, or gray, meaning that their form has not yet been submitted. In case someone does need to figure out if they should report to work or not, this is an example of some of the action plans that Greenlight provides, and an employee can then follow the schematic to figure out if they should report to work or not, or if they should seek testing. In case they do need to seek testing, Greenlight Durham does provide streamlined process for COVID-19 test scheduling in the app. One thing that we do want to highlight is that in partnership with Duke Health, they do not require any tests, any proof of insurance or documentation status at all, and it is no out-of-pocket costs. Greenlight Durham also works very closely with the North Carolina Department of Health and Human Services to leverage coordinated investments, including providing greater access to support services program for individuals in isolation or quarantine during COVID-19. We also work very closely with the community health workers that the state is helping fund during the COVID-19 pandemic. Security and privacy are our top priority, and thus all of the data is HIPAA and FERPA compliant, and we try to collect as minimal data as possible. And this is our business and operations team. The main points of contact are myself and my colleague Pratamesh. We are program coordinators on the team. Here's our contact information, and the rest of our team can be seen at the bottom. And this is the Pandemic Response Network team. They are providing lots of guidance and expertise for the program. So if you want to sign up for Phase 1 today, here is the link. Feel free to reach out with any questions to my email or any of our other contact emails. I am just a ping away and I'm happy to answer anything. Thank you for tuning in.